Welcome to the Revita Health and Wellness Show. I'm your host, Francine Marie, and Dr. Lominchar is back with us, and we're talking about weight loss. It's weight loss season. How you doing, Doc?
I'm doing very well. How you doing?
It's weight loss season.
Yeah,
all
you're still
the time.
full from Thanksgiving? Just kidding.
I know. We are, and we come, food feels so good.
Oh, it fulfill everything. I mean, you can be bored or happy or fatigued or sleepy, and if you eat, you feel better for a little bit.
And that's where you always, you dig into our minds to figure out what's going on with us. But we get disgusted because we failed, Doc.
Okay. Yes. That's why when you come to the program, I go over everything, past medical history and past history of why you are overweight or obese or morbidly obese. And failing can happen in anything. There are patients that they even have had surgery, gastric bypass surgery, and they could have lost 100 pounds after the surgery, and then they go back to their old person before the surgery, and they gain all the way back. And there is a lot of tools to lose weight.
Okay.
And the best tool, I'm not opposed to surgery, is one of them. But you have to have some program. You have to have some good follow-up. You have to have some commitment to yourself to lose weight. You have to have some discipline. You have to forget all your cravings, all your old person. It's a new lifestyle. Whether you have surgery and lose weight, or you come to a program just with a lot of tools to help you to lose weight. And one of the tools is conversation. We need to vent. We need to put together why we like to eat. Why? Because that's the way you were raised. I hear that all the time. My family will get together. It's all about food. And you can still get together with the family, but not all about food. You can always eat fruits or bring your own dish to the party, and then which could be a lot healthier than everybody else. I love to cook.
You've given us so many ideas. That's the main reason for the holidays that we try to avoid a party, or we feel really bad and we just eat the ice cream because the cake is there. Bring your own.
Correct. Another one is you cannot come to the party hungry. A lot of people feel like getting ready for the party. You fix up yourself and fix the hair and all of that. Beautiful. But then by the time you go into the party, you're starving. What is going to happen when you walk in? You start eating.
Yes. And we're going to fill all the voids in our life.
Correct. So you need to eat something healthy and really go to the place almost full.
With confidence.
Correct. So you'll be there for 2 or 3 hours. So by the time in the 2 hours period, you'll be hungry again, but you will never be starving and eat 2 or 3 servings.
Plates. Exactly. Wow. Dr. Lominchar is board certified internal medicine and bariatric, and that is so unique in the Southeast region. And I just want to applaud you for doing what you do and helping us and digging into our heads. And when weight loss is an issue for us, which for some, sometimes we admit it, sometimes we don't.
And that's where the problem is. Sometimes denial. Walk away from what you're doing wrong. And that's why the talking and the psychology part of weight management has to be there. It's not like take the pill, go home and lose weight. It worked for a while, but eventually the weight will come back. So that's why I really, really work a lot and try to have the patients to understand the lifestyle change is number one on the list. Number two, as you using all the tools that I will give you to lose weight, you need to learn what you're doing as you're losing weight, and then apply that to maintenance. You need to maintain the weight doing the same thing you did when you were losing the weight. That's the only way you're going to keep it. So it could be long enough that your body will get used to it, and then you feel like, I love my life now. So it's not forced to do it anymore.
because we have so many resolutions. The new year is here, and we made the resolutions. We've got the list. But I like how you're going to support us, because if we know that we're loved and supported,
Oh, yeah.
we might do it.
That works.
You're going to tell us more about your tools, aren't you?
Oh, yes.
Awesome. Dr. Lominchar is here with us. We're so happy she's here. We're talking about weight loss. You're viewing Revita Health and Wellness Show. I'm Francie Marie. We're going to take a short break, but guess what? We're coming right back.